Lisa again with justorthopedic.com, and I'm sitting across from Dr. John McGarry. How are you again?
I'm doing well, thank
Great.
you.
I do have another question for you. We haven't covered meniscus yet, and I wanted to know if you could tell us today what is a meniscus and how do you treat the injuries of a meniscus?
So the meniscus, you have two of them, and they're in your knee, and I always describe them as shock absorbers of the knee. They sit in between the femur and the tibia, which are the two main bones coming together in the knee. And they sit in between like C-shaped discs, and they're made up of a fibrocartilage. And they spread out the forces in the knee so you don't have high contact areas in just one area. So they basically help preserve the articular cartilage and hopefully prevent arthritis. And it's a very common structure to injure. A violent twist in a young patient, oftentimes in conjunction with an ACL. 50% of the time you're going to have a meniscus tear as well. And then as we get older, like all of our tissue, as we get older, the collagen breaks down, the tissue becomes easier to tear, and simple activities can cause tearing. And a lot of tears probably go unnoticed, especially as we get a little bit older. They may bother some people occasionally, but as a tear gets to be symptomatic, causing pain or mechanical symptoms such as clicking, catching, or locking of the knee, they tend to present to our office. And on exam, they usually have tenderness along the joint line of the knee wherever the meniscus is, and they have pain when you twist their knee. And if this does not respond to a conservative treatment, and if they don't have mechanical symptoms such as locking, you can try treatments with anti-inflammatories, physical therapy, sometimes injections. And if those fail to give them the relief that they want, then an MRI can confirm a meniscus tear, and you can proceed to a arthroscopic surgery where you can either fix the meniscus with suture or trim it out, kind of like a hangnail, if you would. If you had a hangnail and you clip it and then file it down, you can help decrease the pain.
So how long would it take a patient to recover from this type of injury?
If you're going to just trim out the meniscus, it's a very quick recovery. I usually keep my patients from doing any high impact activities for about 6 weeks as the underlying bone gets used to the new weight that they're seeing, and they can kind of upregulate and put more calcium down. But it's a relatively quick recovery, usually crutches for a day or two, limping for a week, and then usually walking normally after that, and then also a faster recovery with a little bit of physical therapy done with a therapist or even an exercise bike. Now, if you repair a meniscus, it's a much longer recovery. You can't start a normal gait pattern after you've repaired a meniscus. You have to have someone walk with a straight leg or a peg leg for about 6 to 8 weeks after surgery so they don't damage the repair. And there are a percentage of those that go on not even healing and may re-tear. But again, keeping your meniscus is obviously the best option.
A lot of great information from Dr. John McGarry today. Again, he's with Plano Orthopedics and Sports Medicine. Thanks again.
Thanks.